Welcome, everyone, and thank you for joining us for HFA's webinar on Staying Covered, Getting Health Insurance During the Fall 2019 Open Enrollment Period. I'm Miriam Goldstein, and I'll be joined by my colleague, Mark Hobrach. Let's plunge in. We know it can be difficult to navigate the world of health insurance, but we also know how important it is for people with bleeding disorders to have quality health coverage. So with the advent of the open enrollment period for 2020 health plans, we wanted to offer some tools that might be able to help as you go about finding coverage for yourself or your family in the coming year. What we're going to cover today is a very brief overview of trends in private insurance in 2019 and for the coming year. We'll talk about some health insurance basics. What are the types of private plans, job-based and in the individual insurance market? And what are my options? When, where, what do I need to consider as I'm getting coverage? So very briefly, some of the trends in private insurance that we've seen in 2019 and indeed for years building up to that are, first of all, rising costs. We all feel it in our pocketbooks. The costs are there for insurers, for employers, and basically for everyone in the healthcare landscape. In response to those rising costs, payers, so basically health insurers, are trying to control costs, and they're doing that by raising premiums. Unfortunately, they're also doing that by making coverage less generous and by shifting more out-of-pocket costs onto consumers. And this is a burden that weighs especially heavily on those people who most utilize and depend on good health care, including people with bleeding disorders. Finally, we'll talk briefly about some actions that have been taken over the past couple of years by the federal government to expand the availability of cheaper but skimpier health plan options. Unfortunately, these actions create some real pitfalls or possible pitfalls for people with bleeding disorders or other serious health needs because the types of plans that are now available in tandem with comprehensive health plans, there are plans out there that will not provide adequate benefits or financial protection to people who have a real need to rely on the health system. We won't go into a whole lot of detail on that, so I would encourage you to follow HFA on social media and to sign up for advocacy updates if you're interested in a deeper dive or ongoing information about policy developments as they occur. But for right now, we want to focus on news you can use during the upcoming open enrollment period. So let's start with a Health Insurance 101. Not the most thrilling, perhaps, but it's helpful to have a common vocabulary and a foundation of what terms mean so that we as we go forward with the discussion. And we'll start with looking at job-based coverage. Getting coverage through your job is really viewed as the bedrock of the American system. That's where a majority of Americans still get their health insurance, though those numbers are unfortunately trending downward. Even for people who do get their insurance through their job, there are a couple of different differences in how that insurance might be provided. And the basic difference there is between fully insured plans and self-insured plans. With a fully insured plan, an insurance company pays the claims and bears the risk there, so bears the cost of all the health claims that come through the insurance plan, and the premium that you and your fellow workers pay covers all of those costs. A self-insured plan is a little different in that the employer is actually bearing those costs. If they're paying the claims and they're bearing the costs of health care. It can be hard to tell which is which because with a self-insured plan, you may still have in your wallet a card with an insurance company name. But with a self-insured plan, the insurance company basically plays the role of an administrator, and the money is actually coming out of your employer's account to pay the cost of the health care used. Why does this matter? What's the importance of this difference? Whether you are in a fully insured or a self-insured plan can affect what law governs your plan. So as a general rule, fully insured plans are governed by state law and subject to state law protections and requirements on what they have to cover, whereas self-insured plans are generally governed by federal law. So that difference between state and federal regulation of the health plan may in turn affect what your plan has to cover, and also where you might go to file an appeal if you are unhappy with the decision made by your health plan. There are a variety of different types of private plans, and when I talk about these basic types, this refers to different ways that plans have of covering your care. So these different types or different varieties of plans can be found in both employer-sponsored insurance that comes through your job, and in the individual market. So health maintenance organizations, or HMOs, have been around for a while, and many people are familiar with them. With an HMO, you need to get most, if not all, of your care through a very well-defined network. You most likely need to pick a primary care physician, and then if you want to or need to see a specialist, you will need a referral from that primary care physician. If you go outside of the network, the HMO network, you will most likely bear all the costs of care from outside the network. With a preferred provider organization, or PPO, you again have a network of providers, but it's not as tightly constricting as with an HMO. If you stay within the network, that means you're using a doctor or a hospital or a pharmacy that has agreed to bill at a certain rate and to accept reimbursement from the insurance plan at a certain rate. So your costs and your out-of-pocket costs will be lower if you stay with an in-network provider, if you're covered by a PPO, but you do have a little more leeway and may have some coverage if you go outside the network. A point of service plan is sort of a hybrid between the two, with a little more flexibility than an HMO would offer. And finally, a high deductible health plan is a plan that comes with a high deductible, as unfortunately many plans do these days. But its defining feature is that it can be paired with a health savings account, and that health savings account can be used to help pay those expenses while you're in the deductible period and before your health plan starts paying. Keeping on with our definition of basic terms, this screen shows some terms that differentiate what you pay and when you pay it. So the first one is the premium. That is the price you pay to have the plan. It's kind of what you pay to enter the system. You pay that monthly. It's a set amount. But the next three categories are all types of out-of-pocket spending that you may need to pay in addition to the premium when you access care. So a deductible is the amount that you have to pay out of pocket before the health plan kicks in. Now, it doesn't apply in all cases. Since the Affordable Care Act was enacted, you can get access to, for example, an annual visit for primary care without first satisfying your deductible. That annual visit does not mean your comprehensive care visit if you are talking about a bleeding disorders comp care visit. It's your basic annual physical. And the plan will pick up the cost of that even before you've satisfied your deductible. But for most other expenses, you're going to have to satisfy your deductible first before the plan starts paying. Copay is a fixed dollar amount that you might have to pay in connection with any service and or prescription drugs. So you might have a $35 copay for an office visit, or you might have, say, a $15 copay for a generic medication. Coinsurance is another form of out-of-pocket spending, and that tends to be a percentage dollar amount. And so obviously that can rise very fast if you have to pay coinsurance, as is typical for specialty drugs, so coinsurance for your bleeding disorders product. Now, out-of-pocket spending is subject to some limits. These are high limits, but at least they're there. Before passage of the Affordable Care Act, there were many plans, in fact, had no limits on out-of-pocket spending. So for the year 2020, under federal law, your out-of-pocket spending is capped at $8,150 per individual, or for a family, a total of $16,300. The out-of-pocket limits from the ACA generally apply to all health plans, that is, whether you get it from your job or from the individual market. And your health plan may have a lower maximum out-of-pocket. The $8,150 is the maximum that can be charged under federal law. The key is, one key thing to consider is what counts toward that maximum. So deductibles, copayments, coinsurance, and basically qualified health expenses for anything that's deemed an essential health benefit counts towards your maximum out-of-pocket spending for the year. It's also important to realize what does not count towards your out-of-pocket maximum. So again, premiums do not count. Premiums are not considered out-of-pocket expenditures. That's the price you pay to just enter the system. Balance billing amounts for non-network providers. This gets back to that problem of when you go outside your network, whether it's an HMO network or a PPO network, you may be charged more than if you are seeing an in-network provider. And finally, spending on non-essential health benefits. So, for example, prescription drugs are an essential health benefit. Inpatient care, outpatient care, emergency room care, mental health benefit, all of those are essential health benefits, but something like acupuncture is not considered an essential health benefit, and so anything you spend on a non-essential health benefit will not count towards that maximum. This chart just illustrates how much of an average consumer's cost will your plan cover. So this is based on an average person, not necessarily a person with bleeding disorders. And the higher percentages on the left-hand side of the chart obviously show that the plan is covering more of your expected healthcare costs for the year. So you can see as you look across the chart, you really have a trade-off between higher premiums and sometimes fewer network choices. As you can see, the leftmost is an HMO, so you would have less expected out-of-pocket spending with these choices on the left, moving to more expected out-of-pocket spending with the choices as you move towards the right. So it's a real trade-off between higher premiums for the plans on the left, lower premiums for the plans on the right, but higher expected out-of-pocket spending. And this is where, if you've heard the metal tiers that are part of the ACA marketplaces, gold plans, silver plans, bronze plans, this is where you can see how they rate in this trade-off between premiums, higher premiums, and lower out-of-pocket expenses.
Thank you, Miriam. I just wanted to go over getting coverage from different sources and primarily in the Affordable Care Act marketplaces. As you can see on the following slide, if you're not eligible for Medicare, Medicaid, another state health program, or health insurance through your job, These marketplaces are really your primary resource for getting healthcare coverage. As you may be aware, open enrollment for all of the marketplaces is now underway. No matter where you live, you can go to the healthcare.gov website to find coverage that is right for you. This web portal will also automatically determine if you are eligible for Medicaid or premium tax credits that can help you to afford coverage. Open enrollment for all states started on November 1st, with the exception of California that started early on October 15th. 38 of these states use what is called the federally facilitated marketplace. They default to the federal government model. Open enrollment for all of these 38 states ends on December the 15th. Please note that this period is different from the open enrollment period for Medicare, which you see on the slide, also for Medicaid, which does not limit when you can enroll. 13 states, including the District of Columbia, created their own ACA marketplaces. If you live in one of these states, the healthcare.gov website will automatically refer you to the web portal for that individual state. 7 of these states have decided to extend their open enrollment deadline past December 15th. This includes California, the District of Columbia, and New York that go all the way until the end of January. However, it's important to check the deadlines, as some have changed since last year. And again, the healthcare.gov website can automatically refer you to the state websites in order to find those deadlines. Now, on the next slide, you can see that there are certain periods where you can enroll outside of open enrollment. Obviously, it's very important to enroll during the open enrollment period, but if you are unable to or have what's called a qualifying life event outside of that period, there are special enrollment periods in which you can still obtain coverage. Details on these qualifying life events are also available on healthcare.gov. The most common ones are the ones you see here, which are things like marriage, divorce, adding a dependent, losing your job coverage, or a permanent move out of your coverage area. It's important to note for students in college that if you live on campus outside of your coverage area, moving to and from your school would also be a qualifying event, allowing you to enroll through a special enrollment period. Another less common but often important qualifying event is if your income goes up or down during the year, making you suddenly eligible or ineligible for premium tax credit. Now, on the next slide, we go into some of the things that are important when you are deciding how to decide on a health plan for a given year. A main point is that it's very important to shop around and not simply auto-renew. You may have liked your plan in 2019, but it may no longer be the best option for you for 2020. This is because for the second year in a row, we will see insurers greatly increase their plan options and coverage areas as they have continued to learn how to best price their products for the marketplaces. Some 60% of plans are planning to increase their marketplace coverage for 2020. Also, premiums are actually declining across all bronze, silver, and gold plans for next year by an average of roughly 4%. How much depends largely on the number of insurers in your particular state and marketplace. Depending where you live, you could see either double-digit decreases for 2020 or an average rate hike of about 6 to 10% if you live in a state like California or New York. Now, on the next slide, we go into some of your coverage options. Again, marketplaces are not available if you are eligible for Medicare or Medicaid or the Children's Health Insurance Program. You can still purchase marketplace coverage even if you have access to employer-based coverage, but you will not be able to get premium tax credits if the coverage offered by your employer is affordable. And the Affordable Care Act considers affordability to be premiums that are more than 9.5% of your income. COBRA, as you can see on the slide, is an expensive option because you have to pay what the employer used to contribute for your premium if you decide to extend your job coverage after you leave that job. You can extend it for up to 18 months, And again, this can be very costly, but it can often be a critical short-term option. Also, don't forget to check if your state has specific programs for bleeding disorders. These are often underused and can provide critical short-term help as well. For example, Texas provides up to $25,000 in assistance for adults earning up to 200% of the federal poverty level. Your provider or HFA can help you identify these programs. Now, on the next slide, for people with bleeding disorders, often the most important questions to ask don't deal at all with cost, but relate rather to whether their provider will be in their plan's network. Marketplace plans typically rely on more narrow and restrictive provider networks to control their costs. So many consumers can find out that their HTC or the hematologist is actually out of their plan's network and will be significantly more costly to see or not covered at all. Problems with out-of-network care is always one of the most common insurance issues that are reported to HFA through what is called project calls, which I will discuss later. On the next slide, just as marketplace plans often use narrow provider networks, they can also have more restrictive formularies than off-marketplace plans. So because of this, it is equally critical to ask before signing up whether the plan uses a preferred drug list, whether your product of choice will be covered, and whether prior authorization will be required. Also, be sure to ask whether the product is covered under the pharmacy benefit or under the medical benefit. This is important because the cost sharing that you must pay can be significantly different. Prior authorization is also one of the most common reasons that we see from project call surveys for having to delay care. As we go to the last slide that I'm going to talk about in this section, costs, especially premiums, are obviously a major factor in deciding which plan to purchase. Affordability is still a huge issue for marketplace consumers, especially if you are not eligible for the premium tax credits that are offered. Those are only available to people earning from 100 to 400% of the federal poverty level. And 100% is just $12,500 or so for an individual, and almost $26,000 for a family of four. 400% is nearly $550,000 for an individual and $103,000 for a family of four. So for those above that amount, at 400% of poverty, the marketplaces can still be exceptionally expensive. However, for those eligible for the premium tax credit, 80% of them can currently find coverage that will be less than $10 a month, or in many cases may be free if you purchase what's called a bronze plan, the lowest premium plan. The amount of the tax credits are based upon the silver plan, which is the medium level plan. But you can use them to purchase any level of coverage. Cost sharing reductions are different, and those are only available if you actually buy a silver plan and if you earn between 100 and 250% of the federal poverty level. So it's a lower window than the premium tax credit. Tax credits, though, can also be used to purchase coverage for your dependents. But of course, if you're not eligible for them, the plans are still often unaffordable, unfortunately, and that's due to very high deductibles and premiums compared to plans outside of the marketplaces. For that reason, California has been one state that has already gone ahead and offered their own premium tax credits for those earning above 400% of poverty. Theirs goes up to 600% of poverty, and several states and members of Congress are proposing similar expansion. However, the most important point, again, is to not focus just on premiums, but the actual total value of the coverage, the actual total cost of the plan. As Miriam pointed out, the Affordable Care Act created annual out-of-pocket maximum limits, and these can be significantly lower if you go up to a higher level plan. So if you spend more on the premiums for a gold or even a platinum plan, very often the out-of-pocket limits can be much, much less. As a result, persons with costly medical conditions like bleeding disorders, they can often come out ahead by paying a higher premium for the top level plans because of the far more limited out-of-pocket costs. And not only are the annual out-of-pocket limits lower, but the annual deductibles can be much lower as well. These higher tier plans are also less likely to require coinsurance for specialty tier drugs or limit the use of copayment assistance, as I will discuss later.
Thank you, Mark. I am going to launch into, as we mentioned at the outset of the webinar, every year there are policy tweaks made in DC or elsewhere that can have an impact on your choices during the open enrollment period. So we've tried to distill some general principles or advice for 2020 based on some developments that we've seen over the past year. And these generally hold true for people who are looking at individual insurance through the ACA marketplaces or elsewhere. So one key piece of advice, it's true every year, but it's especially true this year, is please shop around. This year, we have seen a welcome development that in many markets, additional insurers are joining the ACA marketplaces. So that brings new options. That means that there may be new plans that are available this year that are better than what you had last year. And so it's worth checking what the other plans are rather than just automatically renewing what you had last year. The entrance of new plans, paradoxically, also may mean that your costs increase. Mark mentioned that subsidies are tied to the price of premiums for silver benchmark plans in the ACA marketplace. So paradoxically, the entrance of a new lower cost insurer can actually reduce what your premium assistance is going to be. So you may need to shop, or if you stick with your existing plan, it is possible that your costs for premiums would rise just because the amount of subsidy goes down. So you really have to take a look at the new landscape and see, based on benefits and based on costs, does it make sense to stick with last year's plan, or is it time to look for a new plan? Over the past 2 years, federal agencies in Washington have rewritten the rules governing health insurance with the aim of promoting and expanding access to cheaper but skimpier forms of health plans. And this, as I mentioned at the outset, creates some dangerous pitfalls for people with expensive health needs during the current open enrollment period. The key piece of advice here is really beware of deals that sound too good to be true, because they are. It's a really good idea to start your search if you are looking for an individual insurance policy on healthcare.gov, as Mark mentioned. First of all, the only plans that can be sold on healthcare.gov comply with the ACA standards for benefits and for financial protection. So you're in a market that has some quality control built in. Plus, as Mark mentioned, if you are Medicaid eligible and you're starting your search on healthcare.gov, the website will automatically direct you towards Medicaid, which is a very cost-effective option. Similarly, if you are eligible for subsidies to help reduce the cost of your premiums, you can only get those through plans on healthcare.gov. There are some people who make too much to be eligible for premium subsidies, who make more than 4 times that federal poverty level that Mark mentioned. So basically $50,000 for an individual or $100,000 for a family of 4. And for those individuals who are not eligible for premium subsidies, you may want to broaden your search to look off the marketplace, off of healthcare.gov, because in some states there are mirror plans sold on and off the marketplace, and the off the marketplace plans may be a little more affordable. But again, if you are looking outside the marketplace, make sure to beware of low-cost, skimpy plans that will not cover the benefits that you need to protect your health and give you the financial protection you need. So if you are looking outside the marketplace or on the marketplace, you want an ACA compliant plan or a plan that is called a qualified health plan to get the assurance that it will cover the benefits that cover your health needs. What do you want to avoid? You want to avoid short-term health plans, Farm Bureau health plans, health sharing ministry plans. These are all forms of coverage that do not have to cover essential health benefits, that can turn you down because of your health condition, so you may not in fact qualify. But if you were to qualify, it would not cover what you need by way of health benefits. It would not provide the financial protections that you need. It could cap how much care you receive in a year or how much care the plan will pay for in a year. It could also leave you subject to uncapped out-of-pocket expenditures. So you can see in the graphic on the slide some of the shortcomings of short-term health plans in particular, which are some of the most prevalent non-compliant plans that are out on the market in 2020. Basically, again, if the low rate sounds too good to be true, please avoid it. And this is just one of, unfortunately, many news articles that were published over the past several months of people who thought that they were buying insurance that covered essential health benefits, that provided as much health care as they needed without capping it, that limited their financial exposure, and it turned out, frankly, to be scammed, if not misled, and to her great regret and damage to her health and financial health. So I'm going to turn it over to Mark to talk about accumulator adjuster programs.
Thank you, Miriam. One of the increasing trends that HFA has identified through project calls is the use of something called a copay accumulator adjuster for both marketplace and non-marketplace plans. This is essentially where the health insurance prevents you from applying the value of the cost-sharing assistance that you receive, either from a charity or from a manufacturer, towards your out-of-pocket limit or deductible. These adjusters can abruptly and very dramatically increase the amount of out-of-pocket costs that you have to pay. For marketplace plans, they typically cannot be applied in the middle of the year, but for most states, there currently is no requirement that the plan has to notify you in advance that they are using an adjuster. Very often, the language is buried in plan documents and extremely difficult to find for consumers. More than 90 million people are now subject to some form of accumulators. They can also be called copay maximizers. As a result, we've already seen 4 states, Arizona, Illinois, Virginia, and West Virginia, pass laws that limit or prohibit their use. And several more states are considering legislation for this upcoming year. On the next slide are some other financial resources that are available to consumers. As we mentioned earlier, third-party copayment and premium assistance is increasingly being limited, but is still available in many cases. These are income-based and can be used to offset the cost of, obviously, either the premiums or the copayment obligations that you may have. Flexible spending arrangements and health savings account or health reimbursement accounts are another option that is available. These are The greatest benefit of these is for known expenses that you anticipate, and HSAs have the advantage over an FSA because you can roll over the amounts from one year to the next. But both have the same feature where they allow you to make pre-tax contributions towards the medical care that you expect that you may need. HFA has several resources on their website that provide more detail about the topics that we discussed today, especially the infographic for young adults, for those turning age 26, who can remain on their parents' group health plan. One of the key resources listed here is the Project Calls surveys for consumers to report coverage and payment problems that they are having with their health insurance plans, such as denials of care, problems with prior authorization, being forced to go to providers that don't really meet their medical needs, and limits on their premium or copayment assistance. Consumers can also use Project Calls, as we can see on the next slide, to receive help from HFA with questions about how to navigate the complicated health insurance maze. Project Calls is something that was started in 2015, but starting earlier this year, there was a new streamlined survey that takes only 5 minutes to complete. The responses that HFA receives through these surveys are critical to identifying and shaping the advocacy agenda that helps policymakers better understand bleeding disorders and implement the changes that best meet the needs of the community. As you can see from the charts on the following slide, which are also on HFA's website, nearly 54% of consumers that completed a survey were forced to delay care as a result of their insurance issue. So please take a few minutes to tell us about any issues you are having with your health insurer and how HFA can help use your issue to fix these problems for everyone with bleeding disorders.
Thank you, Mark, and thank you everyone who's listened in to the webinar. I hope this is helpful as you navigate your choices for open enrollment for 2019. And please remember, if you have any problems, to contact Project Calls and to contact us at advocacy@hemophiliafed.org. Thank you very much.